Every cell in our body has receptors for thyroid hormone. It's considered basically our metabolism because it regulates every cell in our body. It's certainly part of all of our hormones when we think about our adrenal hormones, our pituitary hormones, our sleep hormones, such as melatonin, and of course, our sex hormones. They all interplay. And certainly, if one of them is off, all of them can be off. So much thyroid dysfunction and thyroid disease is not diagnosed in the United States because of the way that doctors are testing for it.
Thank you so much for making time to be here and do this. I really
Happy to
appreciate
be
you.
here.
And
Thanks for having me.
yeah, I wanted to delve into the thyroid. And I think that probably there's a lot of people that feel maybe what their baseline of normal is probably isn't optimal, and they may or may not realize it, or they might feel like quite bad. And thyroid could be a culprit in that. How common is thyroid dysregulation or dysfunction with people? And what is the thyroid? And how do we know if it is regulated or not regulated?
Sure. So our thyroid is a butterfly gland that sits right here. I myself had Graves' disease and unfortunately had mine ablated, so I don't have one, but often if you stretch your neck, you can kind of see it right there. And certainly if it's potentially overactive or underactive, you could even have something called a goiter, which is a little, inflamed thyroid gland. So it's extremely important. It's every cell in our body has receptors for thyroid hormone. It's considered, basically our metabolism because it regulates every cell in our body. It's certainly part of all of our hormones when we think about our adrenal hormones, our pituitary hormones, our sleep hormones, such as melatonin, and of course, our sex hormones. They all interplay. And certainly, if one of them is off, all of them can be off. Now, I don't have the statistics because I think that it's widely underdiagnosed, but in terms of thyroid dysfunction, I think, like I write about in my book, The Autoimmune Solution, there is this autoimmune spectrum. Well, there's a spectrum of a lot of things, and I think there's likely a spectrum of thyroid dysfunction all the way from mild dysfunction up to having an autoimmune condition with your thyroid gland. And people may be familiar with those when it's underactive and autoimmune, it's Hashimoto's. And when it's overactive and autoimmune, it's Graves' disease, like I had. Now, there are many people that have a sluggish thyroid, that have maybe a temporarily overactive thyroid, but they don't fall into an autoimmune category. And they may not even fall into a category where they're actually getting diagnosed. And we can dive into that and why so much thyroid dysfunction and thyroid disease is not diagnosed in the United States because of the way that doctors are testing for it. And happy to get into that. But I would say it's extremely prevalent, more prevalent in women than men. And like many conditions, it's happening at younger ages now. It's happening to men and women. And so it's really, an epidemic, actually.
I would love to get into the tests that you would recommend and maybe some of the issues that some of the common tests that people are taking. And also, I'm curious, since you just mentioned that, why is it becoming more common and more common with both men and women and more common with younger people?
Sure. So the test, most doctors are, if they're even checking, I mean, they should be checking at least at an annual exam, a TSH, but that's really, our feedback mechanism or lab test of how the thyroid is working is not actually looking at what is active and what is going into those receptors that I mentioned. And so most doctors are only checking a TSH. If that's off, then sometimes they have what's called on a lab slip a reflexive T4, meaning that if your TSH is outside of the normal range, which we can talk about is normal and not optimal. So if it's outside of the normal range, then it will reflexively look at a free T4. But the most active form of the thyroid is actually T3, and free T3 is the measurement of the circulating free T3 in your body that's actually going into all the receptors and making these cells activate and causing your metabolism to work and things like that. And so most doctors are not checking that. On a panel that I generally run when I was seeing patients would be a TSH, a free T3, a free T4, a reverse T3, because the free T3 is like your gas and the reverse T3 is like your brake. And so and there is also a total T3 and a total T4. And so some doctors who think that they're being integrative or checking things outside the box might check a total T4 and a total T3, which again isn't telling you exactly what's happening with those free hormones that are going into the receptors. And then I typically would check antibodies on all of my patients, at least in the beginning. And then, of course, if they had elevated antibodies, we would track them as they were typically coming down while they were following my program.
And antibodies would indicate autoimmune.
Yes.
Yeah.
Yes. And so that's a huge thing that most doctors are not doing because they believe that, once you have an autoimmune condition that you cannot reverse it and that you're destined to a lifelong of hormones or medications. And, I believe differently. The statistics show that these antibodies come out about 5 to 10 years before there's enough destruction of an organ to actually be diagnosed with an autoimmune condition. And so very frequently in my clinic, I would find antibodies on people that had no symptoms yet. And we would go through my program and they would reverse their or reverse these antibodies. And then ultimately never ending up with a diagnosis of an autoimmune condition. So those are the lab tests. And then I think the question was, why are we having such an epidemic? And that's a really big question. And I think a lot of it is what I talk about in my books. We have leaky guts. We are being born by C-section. We're not, getting inoculated with our microbiome as we're coming down through the vaginal canal. Children are taking lots of antibiotics for ear infections. Yeah, they're being born with lots of toxins. We're exposed to toxins, particularly with the thyroid gland. We're being exposed to many endocrine disruptors through our plastics, through the Teflon, through makeup, through body products, through environmental exposures, through our air, through our water, and so all of these things are disrupting our thyroid gland and all of our hormones. I mean, there's an epidemic of infertility going on right now, so we have all of these things: leaky gut, toxins, infections. We're living in a stressed out society, and then all of this creates a scenario to disrupt the gut microbiome that then can disrupt our thyroids and lead to autoimmunity.
Is there any within the umbrella of endocrine disrupting compounds that we're kind of like swimming around in modern culture? Is there any particularly egregious offenders that you would say this is really important if you care about your hormone health to make sure you're getting XYZ thing out of your daily lifestyle?
But definitely would not be cooking on any kind of nonstick pans. I use stainless steel or cast iron in my home.
Is that because of the PFAs, or
Yeah,
is there other factors in that?
yeah, yeah.
Can you elaborate a little bit of like why nonstick is an issue?
Well, I mean, I think that, again, I'm not an expert here in terms of nonstick pans, but that the PFAs are, mimicking our hormones and disrupting our hormones, which is the same as, I don't even want to say beauty products. I mean, it's just body products, cleaning products, it's anything our skin is our largest organ. So anything you put on it, or anything you touch, frankly, is going to be absorbed through the skin or potentially absorbed through the skin. It's how we're able to give certain medications as topical medications, or females if they're on or men on bioidentical hormones. Typically, that's given as a cream. So these things can be absorbed in our skin. So looking at any kind of product that you're using, if you're a female and you're using makeup, hair products to shampoos, soaps. I mean, I stay with just like Dr. Bronner's soap that has unscented. It's, one of the cleanest soaps out there that you can use. So looking at the ingredients, and then cleaning products in your home are also known to be, toxic and to be endocrine disruptors. And, so typically we're just using vinegar and water in my house, or alcohol. in my house. You can use things like Dr. Bronner's soap. The scary thing about all of this is that, when the EPA was set up, what they did is they relied on these companies to prove that their products were safe. Not, there's not independent testing happening. I mean, the EPA has said, oh, you want to bring a product to market? Okay, come, you can have it. Now do all the testing and tell us if it's safe or if it's toxic. And they're relying on the people who are not incentivized, to do the studies. Or maybe, one ingredient in a product, in a cleaning solution, let's say there's a cleaning solution, it has 5 different ingredients. Well, maybe one of the ingredients on its own is safe, and each individual ingredient on its own is safe, but when combined together they are no longer safe. But they don't have to do the testing on the combined 5 ingredients. They can do the testing on the individual ingredients and then release the product and say, oh, see, all 5 of these ingredients are safe. I mean, it's pretty backwards that, that they're able to do that. And these are things that we can't see, we can't smell, they're just out in our environment often. And so, you kind of think like, oh, something smells bad, maybe it's toxic, but many of these things don't have a smell.
Do you happen to, I don't expect for you to have an answer to this, and so it's okay if you don't, but do you happen to know anything about the mechanism of what is happening in the process of endocrine disruption? Like how these compounds actually, are they binding to some receptor or causing something? Like, are they mimicking a hormone and the body thinks it has enough of that, so it downregulates it? Or
Exactly. I mean, there are many. So take, for example, in makeups and beauty products, there are things called xenoestrogens. So they mimic an estrogen. They look very much like estrogen. It's one of the theories behind why young girls are going into puberty so much earlier now, not only from the antibiotics in the meat that they're eating, but also because of all these endocrine disruptors. And even if they're themselves not using beauty products, many of these medications, xenobiotics, xenoestrogens are in our water supply. And so we're drinking the water, and so we're getting it that way. And I don't do much social media. You and I were talking about this, but um, I saw something about these little girls who are tweens going into, that have these TikTok, um, I don't know, whatever you call it, accounts, and they're 6 years old and they have their beauty routines, and then they're walking into the Sephora and other places, like demanding, all these products. So, apparently there are six. I mean, I wouldn't even call a 6-year-old a tween, but a 6, 7-year-old, and then tweens that are already starting with these beauty care routines, makeups, things like that, and so they're just even getting exposed at an earlier age.
hmm, wow, that's like pretty, that like affects me, like thinking about the impact of that, or what the impact could be. So I would imagine when we were talking on your podcast, you asked me about nutrition, which I don't really talk a lot about. My first response was the things to take out. Would that be, is a lot of this stuff from your perception, would it be like non-negotiable? Just you can't have, well, not can't, but it would be very, very wise to just remove these. And or is there a way to ameliorate if, say, we can't get away from certain things?
Sure. So whether you're talking about toxins or food, I mean, the way that I like to particularly talk about just exposure in general is preventing things from coming in. And so, how do things come into your body? You breathe them in. So, having clean air, having HEPA filters in your home. Perhaps if you have the ability to live somewhere with cleaner air, have clean air, breathe clean air. How else do we get all of these substances into us? We drink them in. Water. So making sure that our water is filtered. We of course ingest them through our food, so making sure that we're eating organic food. We put things on our skin, like I just discussed. So making sure that the things that you're putting on your skin or that you're using in your home that you could come in contact with or that you would breathe, that these are all clean products, not green products, because that's there's a whole greenwashing going on, but truly clean products. Again, like you were talking, get rid of the foods in the package that you can't read the ingredients. Look at the back. I mean, what is used in my house? Distilled vinegar and water, or alcohol. the only ingredient, right? Castile soap. It's the only ingredient. I know how to pronounce it. I know what it is. So, and then how do you get these toxins out? You pee them out, you sweat them out, and you poop them out. So making sure that you're peeing every day, making sure, I mean, multiple times in a day, making sure that your urine is clear, that it's not dark. That means you're dehydrated. Looking to poop them out. Most people, if you're lucky, they poop once a day. Well, ideally, we should be eating and pooping. So that would be 2 to 4 poops a day, bowel movements a day, and then sweating. I live part time in the desert, so it's difficult for me to sweat here, and so I have an infrared sauna that I get in. I try to get in daily, but we'll just say on an average 4 to 5 times a week, and I make sure that I sweat. So doing these things on a regular basis, and then I can't tell you that everything's whatever is a non-negotiable. I travel a lot. I like to travel, both for work, for pleasure. I have a child. We go out about in the world, and so I say do what you can in your own home, and then when you go out, make the best decisions that you can, right? I mean, I travel with I don't rely on the beauty products or the soap in the hotel. I mean, the first thing I do when I get in the hotel is like clear all those mini bottles out, and I put my travel Dr. Bronner's there and my homemade toothpaste. And so I bring these things with me, and then I make the best choices that I can while I'm traveling.
Hmm. I really appreciate you and just the way that your mind works and how concise you are with all this stuff. The something that comes to mind in relation to autoimmune and thyroid dysregulation and things of the like. Could there be I think that the pedantic, unnecessary term would be like a psychoneuroendocrinological lens, like a psychosomatic aspect to dysregulation of a thyroid or an organ of any sort? Could there something be from your perspective? It's okay if you're just like, no, I don't, but could there be anything that's like emotionally tied to that?
Absolutely. I mean,
Yeah.
I think that the deeper I go, the more we see how these traumas, and whether real or perceived, right? Whether you have a real trauma or you think you have a trauma, or you remember a trauma that maybe wasn't that traumatic, but you keep remembering it, these things can keep you in a state. I've often used this example. In interviews, I had a patient one time who she was from somewhere in Africa, and she had been, had a very, very traumatic life, and fled for asylum here in the United States. And she had vitiligo. And she was telling me that she was an interpreter for other women in Africa in her same boat. And as an interpreter, she has to literally interpret. So she has to say I. She can't say she. So she was telling me this, and I said, I think you need to quit your job. I think that is why you still have vitiligo, because you are saying I, and you are taking on these other people's traumas through saying I, by interpreting for them. She, of course, was very, very upset, and felt that this was her way of giving back, and I totally understood it. But I said, I mean, this is, I think this is the final piece for you. And she got very upset, and she didn't come back to see me. And about a year later, she called me and let me know that she had quit her job and her vitiligo reversed. So 100%. I mean, the mind body connection is way more than we know. And as you and I were talking about, Joe Dispenza's work, and
Right. Good.
um,
Okay, cool. All right.
and
Then I'm safe. I can talk normal. I can be
yeah, of
candid. I was like,
course.
I wonder if anytime I go into like the psychosomatic kind of realm, I'm always kind of like, are you like full Western whitewash, or like what's your level of openness to stuff like this? Okay, so something that someone told me one time, this is, take this grain of salt, take it or leave it, whatever. But I was talking to a functional medicine doctor friend about thyroid dysregulation, and what she had suggested, which I thought was just kind of interesting. And feel free to not have anything to share about this, but she suggested that a part of why women are so it's so much more regular with women. Her suggestion was a blockage of their throat chakra and like their voice and their expression, and this is now a physical manifestation of femininity and women kind of being like blocked from being able to speak and communicate, and that manifests tension arising in and around the space, i.e. like exactly where the thyroid is. I'm not saying this is what it is. It's just kind of she said that, I was like, That's an interesting way to look at it.
First of all, I never, in general, think that anything is one thing. I think it's all part of the puzzle. And so I think for some people that can be part of the puzzle. If you knew me, you would know that I don't really have any trouble speaking up. But as a child, I didn't have a say. My parents divorced, and I have a brother who's a year and a half older than me, and my parents split, and my mother moved back to New Orleans, which is where both my parents are from. My father stayed in South Carolina, and they split us up. So I did not grow up with my brother. And so there was a lot of things I didn't have a say about. So as a child, I guess I didn't feel that I mean, I did speak up, but it didn't get me anywhere. So and then during one of the Joe Dispenza meditations, I was doing the body electric. I don't know if you're familiar with that one, but it was an extremely powerful meditation for me. Though I don't have any trouble speaking up, I'm not a person that would want to share an emotion in front of 2,000 people. And on the second day, I started laughing and made 2,000 people laugh. The entire room started laughing, or maybe about 1,500 because there were some people who didn't laugh. But anyway, I had this contagious laugh that literally had the whole room laughing. And then on the final day, after everybody's gotten up from this body electric, I'm still in this meditation, and we're at the fifth chakra, and like suddenly this roar comes out of me. So I do all of that to say is I do think that there is something to that. I don't know that that's it for every single person with, thyroid dysfunction, but I think it can certainly be a piece for people for sure.
Well, everything is like vibration, and if there's certain parts within the body that are trapped in stasis, they're stuck, it's energetically it could be something along the lines of whatever could cause that, but just physiologically, physically, if there's a place within the body that's contracted chronically, it's not going to be able to circulate fluids effectively, it's not going to be able to
Right.
function effectively, it's not going to be able to have effective communication with the rest of the systems in the body, and it will start to go into dis-ease. And if there's something like in that situation where you go through this body electric meditation thing and you get up to it happens to function that you get up to the fifth chakra, i.e., thing that called fifth chakra in the throat, and you feel this kind of like subconscious urge to like vibrate your throat, it's like, cool. That seems like that would be supportive for the connective tissue and the cells and the organs around that space. Sounds like science, right?
Yep.
Yeah. All right. Well, thank you for allowing me to go into some of that like more esoteric aspects of it.
Absolutely. I mean,
Um,
I definitely don't think we have all the answers.
For sure. Yeah. And so within that, I'd be curious your lens on medication. At what point is it appropriate to medicate thyroid dysregulation, whether it's Hashimoto's or Graves or something that wouldn't be considered autoimmune? Would there be a differentiation of that, when to medicate, when not to medicate? And if you do choose to medicate, would medication be a crutch to eventually wean off of into having a more natural, like whatever? For you, I'd imagine you'd have to be on medication because you're thyroid was ablated, I would think.
Yep.
Anyways.
Well, the first thing is I don't call it medication. So
Oh,
we
great.
don't
Okay.
call insulin, medication for a type 1 diabetic. We call it life-saving insulin. If you have Addison's and you need steroids, it's life-saving steroids. Your body doesn't produce these things. So yes, in my case, I don't have a thyroid because I didn't know me, and functional medicine really wasn't, around when I had Graves' disease, even though I, did everything I could to research, to avoid, doing what I did. So, it's life-saving thyroid hormone for me. And so I think honestly, and this isn't at you, there are many people out there. In fact, feel like I'm one of the few that corrects people and calls it, a life-saving hormone and not a medication, because there are so many people on the internet that are not physicians, and they're kind of in a way shaming people who have lost part of their thyroid or it's been destroyed by autoimmunity. I mean, it takes 5 to 10 years for many people, bouncing around to multiple doctors to get diagnosed. And so in that time, their thyroid tissue could have been destroyed. And, as of now, we don't know of a way to grow that back. There was a woman who did Joe Dispenza meditations that grew hers back. There's some people talking about, doing stem cell therapy. But I mean, right now we don't have a way to grow back the thyroid, one that is universally, known and used. And so those people, if their thyroid is not at optimal levels, then they will need thyroid hormone. And I don't want anybody to make them feel bad or feel like a failure because, um, they didn't know. And in the meantime, while they were seeking answers, their thyroid was getting destroyed by their body. Now, so back to your question. So with Hashimoto's low thyroid, where it is an autoimmune destruction of your thyroid, if you are caught very early, yes, there is a way. Look, either way, there's a way to reverse these antibodies. So there's no further destruction. 100% done it with literally thousands of people, hundreds of thousands of people around the world that have read my books that I've never met have reversed many autoimmune conditions. But if you've destroyed a vital organ in the process, you may need to take some supplemental thyroid hormone. But if we catch it early on, just like a type 1 diabetic, we may be able to avoid going on any of those life saving hormones, or at least avoid it for a while. And the question I always get asked is, well, if I still have to be on this, what's the point? Why should I still fix my gut and all this other stuff? Well, it's because you don't want to have any further destruction, and you want to reduce these antibodies, if not get them to go away, which is your fire. You want to put out the fire. And those of us with autoimmunity, with one autoimmune disease, are 3 times more likely to get another. And the next time it may be MS or rheumatoid arthritis or lupus or something that you really don't want. And so I do encourage people to still go through the program and do what they can to heal their gut and reverse their autoimmune condition. And then when it comes to Graves' disease, that's an overactive thyroid. So again, I've helped many, many people reverse their Graves' disease. Sometimes, as with other autoimmune conditions, many times people would already come in on immunosuppressive drugs or medications to shut down their thyroid. And I don't ask people to get off those on day one. I say, let's get a foundation. Let's heal your gut. Let's start reversing all of this. And once you have a foundation, people will notice, oh, I didn't need my injection this week. I waited 2 weeks. Oh, I didn't need my pain medicine today. Oh, I felt a little, I felt really extra tired. So I reduced my dose of methimazole or whatever. So what we do is, either if you've come in and you haven't been on a medication, we try to keep you off of it and reverse your Graves' disease. Or if you're on a medication to shut down your thyroid, I was on PTU and I ended up being 1 in a million and got toxic hepatitis from it. And so I immediately had to go off of it. And then, was given the choice of a thyroid ablation or a surgery, and I chose ablation. And, what we do is try to keep you off the medication, or if you're on medication, to slowly wean you off the medication while, following the program in order to reverse your Graves' disease.
And what would be and you have all this in your book, I'd imagine.
Mhm.
Yeah. So I guess I think probably the best thing would just be get. And this would be, what is the book called?
We're talking specifically about, thyroid. So the Thyroid Connection I wrote as a book to reverse Graves and Hashimoto's, as well as to work with your doctor. So it goes over which lab test to get, and what we actually didn't talk about regarding the labs was optimal versus normal. So the reference range, at least for TSH, what we now know through the many studies, is that when they were coming up with the reference range for TSH, they actually had a bunch of hypothyroid people in that range. And so even the Academy of Endocrinology recently, probably now 10 years ago, advocated to reduce that reference range. So just because you're normal doesn't mean that you're optimal. And that goes for any blood test, frankly. But certainly when it's coming to the thyroid, you really want to be like in the middle. And so with a TSH, I like it to be around 1. A free T3, I like it to be around 3.2. Free T4, 1 or above. And so I talked, in the book about what lab test to get, what is an optimal range, not just a normal range. Of course, there's a 30-day program, to reverse your autoimmunity. And anybody listening that has a different type of autoimmune condition, my first book, The Autoimmune Solution, is a program to reverse virtually any autoimmune condition.
What would some of the kind of long levers in the autoimmune, like reversing autoimmune, be that you could share? Long levers in like things that are really effective.
Yeah, the first one is to heal your gut. So I mean, I have the it's called the Myers way, and there are 4 pillars to it. And the first one is heal your gut. And that is really, I say the gut is your gateway to health. I've been saying this, everybody's talking about gut health now, but this was over 10 years ago when I wrote these books, that the gut is the gateway to health. And particularly when you're dealing with autoimmunity, I mean, nearly 95% of our immune system is sitting right there in our gut. And so,
And serotonin as well, right?
yes, yes. And so it's the first place that I start is healing your gut in terms of, I mean, it was on the cover of Scientific America, what, 15, 20 years ago, Alessio Fasano, who, is the researcher that basically coined the term leaky gut, and he and his team also discovered zonulin and named zonulin, which is the molecule that gets released when you have a leaky gut that sort of keeps those drawbridges open. And, he said back then that there's sort of a three-prong approach to autoimmunity. And one is sort of, having these, genetics potentially, and the other is having some sort of antecedent, something that happens, whether it's a toxic exposure, a stressful exposure, an infection, and then leaky gut. And I recently interviewed him on my podcast now, 10 years later from my first interview with him. And his initial interview said, and that's kind of the theory behind cancer too. And I asked him this time around, 10 years later, I said, "Does that confirm now with cancer?" And he said, yes. So leaky gut is now implicated in cancer, and I mean, frankly, many chronic conditions. So
So that makes sense that the gut would be kind of like an epicenter of pretty much everything. Um, where should so are we still talking about the thyroid if we're talking about the gut then? And is it appropriate to go into gut health in association to hormone health?
yeah, I mean, well, we were speaking to that, or I was speaking to that in reference to autoimmune thyroid, but I truly think that, any chronic health condition, focusing on your gut is never a bad thing, right? I mean, there's studies showing, where they've done fecal transfers of, skinny mice into fat mice, and then they become skinny and vice versa, or
Also
depressed
depressed,
mice.
depressed and happy
Yes,
mice. Yeah.
and yes, and vice versa. So our gut microbiome, is really regulating a lot of things, which is in some ways connected to leaky gut, but also also very different with leaky gut as well. So
How
healing
the
your
heck do you think that works? Because that is so amazing to me that you can throw some gut bugs into your system and they proliferate, I presume, and suddenly you become a different person.
I saw it all the time, even though I'm written a book about autoimmunity and thyroid. Honestly, most people searching me were searching for gut health because I wrote so much and have programs for SIBO and Candida. And so, I saw it all the time. People with SIBO, they weren't, absorbing nutrients because of this overgrowth of bacteria, which was leading to, all kinds of problems. And certainly with Candida, what I saw was Candida basically kind of laying a layer over your gut, and then your body not able to secrete your, serotonin or secrete your IgA. And so on labs, I would see a low IgA, and people were, sent off to the oncologist and all this stuff thinking, they've got some massive problem. It's like, no, 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 you just got yeast, right? And then they're depressed. So they come in, they're, on an antidepressant. We treat the yeast, and suddenly that's gone, and their body can just naturally produce their serotonin and their IgA. And so, they no longer have immune issues, they're no longer depressed. So, I mean, I saw it all the time, just not even doing fecal transplants or anything, just fixing the infections and or the dysbiosis happening in their gut. I saw all kinds of problems. ADD, ADHD, a lot of times get relieved. And that's multifactorial, from not being able to absorb certain vitamins, so the brain wasn't functioning, to having candida, so they weren't secreting neurotransmitters properly. So
What are we doing wrong as a culture for this stuff to be seemingly incessantly on the rise when we have access to all the things that should make us like happy and healthy?
well, I think that's the problem, right? We have access to too much, right? We have access to calling a doctor and requesting a C-section. So our children are not going through the birth canal. And even though there are many, many studies showing that if you do need to have a C-section, that's totally fine, but you are at higher risk for future allergy, eczema, autoimmunity. But if you simply take a swab of the vaginal canal and get all of that good bacteria, and you do something called seeding, my daughter is actually adopted, and she was a C-section, and so we seeded her, and these things, they've shown studies that the seeded babies had a reduced risk of autoimmunity, a reduced risk of allergy, eczema, and it was equivalent to those babies that had been born naturally through the vaginal canal. So we have access to all this processed food, right? I mean, we have access to too much. I quickly was just on, just doing something on social media right before you and I got on, and somebody had posted a picture of some people on the beach from the 1970s. It was like, look, there's no one overweight, right? We didn't have the processed food back then. We were delivering our babies naturally or more naturally. We were breastfeeding. We, didn't have, of course, we had cars, but we didn't have all of the conveniences that we have now. We Instacart and Uber Eats and all of the things where it just everything gets brought to you. You don't need to walk somewhere. You don't need to cook. I mean, I grew up, my mother taught yoga. My parents made, we were talking our whole discussion on brown rice versus white rice, but I grew up on brown rice. I grew up with real whole foods. We got Cheerios when we went to my grandparents once a year for Christmas. I mean, that was like, and we got Cheerios and a couple of like those little cereals. They would buy a box of, I don't know what it was, 10, and my brother and I would divvy them up at Christmas. So five little packs in one year. That's all I got. My mother made homemade granola. There was no sugar in the house. It was honey. She made homemade whole wheat bread. She made yogurt. She knew about the microbiome. So, I mean, and now look, I still hear that my upbringing was somewhat unusual compared to my peers, and that my parents were quote unquote healthier than the average people. So I'm thankful for that. But, still people cooked food when I was growing up. I remember the invention of a TV dinner. I thought they were absolutely disgusting. Whenever my parents went out, my brother loved the Salisbury steak, and I was like, well, what am I going to eat for dinner? Because that is gross. I'm not eating that frozen thing. So life is just different, and we have too many conveniences. I mean, it's all the things we talked about, the leaky gut, the toxins.
So for a person that is on exogenous hormones or life saving, how do you call it? Life saving medication? What was the
Yeah.
term that you said?
Life-saving hormones.
Life saving hormones. Yeah, yeah. So if they're on well, I didn't mean to say yeah, yeah, as in like pushing you along. I retract my yeah, yeah. Life saving hormones. They there is a point of no return, I would presume, for some people. For a person that is not in that place, and maybe if you talk to Joe Dispenza, he would disagree with that. But so let's maybe keep that door open as well. What would be the process of walking a person from the life-saving hormones back into their body endogenously functioning on its own? Generally, obviously, that's a highly variable question.
Sure. And so, I mean, just speaking, from a medical term in the 3D world that we live in with what we have access to, um, I think it depends, are you me, that I literally have virtually no thyroid tissue? So, I'm going to need some outside the box, massive medicine journey to medications to regrow my thyroid. That's not going to happen. But what I've done is at least gotten rid of all my antibodies, so that I know that I no longer have antibodies to attack what little thyroid tissue I have. And then, I'm on my supplemental thyroid hormone. I take, Armor. So I have T4, T3 in it. And, am trying to do some of all the outside of the box stuff too. But, I feel good. So I'm not, you know, waiting for the next whatever. Then you have somebody who maybe has Hashimoto's, or let's say maybe they had thyroid cancer and they had half their thyroid cut out or part of their thyroid cut out, or something. They don't have a fully functioning thyroid, but they have some thyroid gland. Can their body compensate for that? It is possible, but they may need to be on some amount. And then you have the other person that had low thyroid, maybe because we haven't even talked about iodine, maybe they had low thyroid because they were just pregnant, or maybe they had been exposed to a big stressor. They just went through a really stressful, a death, divorce, something really stressful. I do believe that these can be temporary, and that, maybe they're supplementing briefly and then they figure out what these triggers were for them, and they're able to, get off that supplemental thyroid hormone. I mean, that is possible. I see those types of things all the time, but that's somebody who has a fully intact thyroid that had, an assault to themselves or to their thyroid. And can they get rid of all of, can they pull the tack out of their foot and, go back to optimal functioning? Yes. So it's just the people that have really either destroyed part of their thyroid, but while before they were getting diagnosed, they had it surgically removed, or like myself, it's been ablated. That one's a little bit like, I just don't want people to feel like they've failed, or be hard on themselves if they're not able to get off this life-saving supplemental thyroid hormone, because um, they don't have a full gland. It's like somebody who donated a kidney, and then expecting that they're going to have normal or optimal kidney function using one kidney. Is it possible? Sure. But is it, likely for most people? Probably not.
What do you see for doctors prescribing thyroid life saving hormones, or whatever they're prescribing in relation to thyroid dysregulation? What do you see the most common mistakes that would be important for people to know going into a medical visit, for them to have some information and some questions that they should be asking if they're going to see a doctor?
Right. And I do talk about all this in my book. And I just say, from the people that I know that have taken the book into another physician, it's generally pretty well received. I do have an MD degree from a conventional medical school. I went through a conventional ER residency, and then I went into functional medicine and went through all the training with the Institute for Functional Medicine. So when they see that MD behind my name, I generally get a little more, respect. I don't know the word, when they're bringing in the book. So I do encourage you to physically bring your book into the doc, into your physician. But first of all, I would say probably even amongst functional medicine physicians, probably the biggest, I don't know, misnomer or confusion is that there's one right type. I For some people, Synthroid is just fine. For other people, Nature Throid is better. For others, Armor is better. These companies are also constantly sort of changing their formulas. And so you need to be, aware of that. There was a period where I was using a lot of Armor, then I switched to Nature Throid. Then there were a lot of problems with that, and I went back to Armor. I myself do really well on Armor, and I take a little bit of Synthroid. There also, early on, I took Synthroid and compounded T3. So I think it really depends on your personal situation. And so don't let anybody tell you like, oh, this is the only form, or this is the only one that I prescribe. Anybody should be open to prescribing any of them and in any combination to make you feel as optimal as possible. And so I think that's probably the number one. And of course, if you're going to a conventional doctor, they're definitely going to say Synthroid, or, oh, there's also studies showing that the brand, or that the generic was way more widely variable in what it said it was than the brand name. So that is one medication or a prescription that I tell people, do get the brand name. I mean, I personally pay, like my insurance would pay $10 a month for the levothyroxine, and I pay 60 out of my pocket to get the brand name Synthroid, to make sure that, I'm getting what, you really want it to be consistent. But conventional doctors are generally just prescribing Synthroid or levothyroxine. At best, they're, prescribing the generic form. And so that is T4 only. It doesn't have any T3 in it. And if you are a person like myself who doesn't have a thyroid because you had Graves, you had thyroid cancer, or you only have part of a thyroid, I would 100%, I find that generally those people do better on a T4, T3 combination, such as armor, because their body just has that much harder of a time to convert T4 to T3 because they don't have a thyroid or they're missing part of their thyroid.
Hmm. Could you share? I really, once again, I appreciate you outlining all this stuff so specifically. I'm sure you've talked about this in lots of other places. So I appreciate you having the patience for me to
This
ask these
is the way I
questions.
work.
All right,
I'm
good.
very
Uh,
logical.
yeah, no, I love it. I appreciate it. Um, I'm not completely clear on the difference between thyroid problems, for lack of better words, dysregulation issues via autoimmune versus not. What would induce something that's not actually the body attacking itself or producing antibodies, as evidence of that, compared to just the thyroid's a little slow or a little fast, or fast probably isn't the right word, but
So, so for an overactive thyroid, things that are non-autoimmune, viruses, Epstein-Barr. I mean, there have even been case reports of COVID, of people getting transient, meaning it's not long lasting, but it's, temporary hyperthyroid. So the virus gets into the thyroid. I mean, there are many thoughts that Epstein-Barr, is one of the reasons for autoimmune thyroid. Pregnancy can cause your thyroid to go up or down. Birth control pills on their own, because there's a thyroid globulin, it binds. So a lot of people, when they go, I mean, most people don't know this, but often, certainly if you're on thyroid hormone and you get on birth control pills, you'll likely have to increase your thyroid hormone. Just like when you get pregnant, you likely will have to increase your thyroid hormone. So, many young women are on birth control pills, synthetic birth control pills. So that can cause hypothyroidism. There could be, lack. You need a number of vitamins. I actually own a supplement company and created, when I wrote the autoimmune solution, I had so many supplements that people needed to take, and I still stand by that. But it was a complaint I got. So when I wrote the Thyroid Connection, I formulated my multivitamin, the Myers Way multivitamin, with what I believe everybody needs to help prevent any type of thyroid condition or to get out of it. And so that was my goal in that book, was to really only have a couple of supplements that people needed to take. So my multivitamin is 6 pills, but it really has everything. So there's iodine, 150 micrograms of iodine. We can get into the iodine controversy. There's vitamin A, there's vitamin D, there's calcium, there's B vitamins, there's zinc. So you need a number of nutrients for your thyroid to function and to make the conversion from T4 to the active form of T3. So you could be low in one of those nutrients, so your body's not making the conversion. So even though your T4 is fine, maybe your free T3 is not. You could have low iodine, which is common for many, many people now. And so you could also have a low functioning thyroid because you don't have enough iodine. So there's a variety of reasons of why you could have an overactive or underactive thyroid. And if you'd like, I can jump into the iodine controversy, which
yeah,
is
yeah,
that,
iodine seems like a maybe a potentially tricky one for some
yep.
people.
So I have a whole chapter on that in the book because it is a controversy. I saw many, many people coming in from other providers taking 25, 50 milligrams of iodine, and iodoral is what many people were taking. And that is the thing that caused their thyroid to, you know, crap out, go overactive, go underactive. So, back in the day, we were eating lots of shellfish. We were eating lots of things that contained iodine in it. Our salt was iodized, and then we didn't have as much of the other halides. So our water wasn't fluorinated. We weren't swimming in chlorinated pools. Our baked goods didn't have bromides in them, and
What was
so
the term you said? Halides?
halides. So that's on the periodic table. That's fluoride, bromide, fluoride, bromide, chloride, and iodine. So
Hmm.
they all, you know, they, just like the xenoestrogens, these can come in and interact in the receptors for where iodines should go. So they're basically displacing iodine. So people are drinking fluorinated water, they're swimming in chlorinated pools. There's, chlorine all over the place, right? You honestly, like when you go get your vegetables are washed in chlorine or in chlorinated and fluorinated water. And then, baked goods now have bromide in them. And so all of these displace iodine, and we are no longer eating, the seaweed, the shellfish. Our salt isn't iodized anymore. So it's this double-edged sword that we're not getting the amount of iodine in our diet that we used to.
Why is salt not iodized?
I think that they thought that it was causing goiters in people. And then we have the other halides are displacing what iodine we have. So I am a proponent that I do believe we are all have low iodine based on what I just said. Now, what I have in my multi is 150 micrograms. And what I often see some other practitioners doing is huge amounts, 25 to 50 milligrams. So this is thousands and thousands of, you know, dosages higher than what I'm recommending. So I'm recommending, that you eat some seaweed and, don't we have a huge, I have well water here and a huge house filter. And a saltwater pool. So, try to get rid of the other halides and add in some iodine. And that can often wake up a lot of people's thyroids for them.
Amazing. And with, would you recommend like binders or anything to kind of extract these heavy metals or minerals or?
Yeah, they're not. I mean, I think that's just your regular sweating, peeing, pooping that we talked about. These are not considered like heavy metals. I don't know that they're necessarily stored in your body. I mean, there is the thought that when you start taking this iodine, it will displace them out of your body. So, I mean, that's a different conversation. I mean, I do think binders can be a good thing for a lot of people, in the world that we live in. Just be sure to take it away from the multivitamin if you're taking it, and be sure to take it away from your thyroid hormone if you're taking it, because those things can bind the minerals in the multivitamin, and they can bind your thyroid hormone as well.
Is there any manual approaches you would recommend to be supportive to the thyroid? Manual as in like hands-on or vibration or singing or playing a didgeridoo or anything of the sort?
Well, I mean, I can't speak to
Especially the
that.
didgeridoo. That's my main curiosity. The
Yeah,
didgeridoo.
I can't speak to that, other than, I've pretty much tried everything myself, and am a fan of trying anything, as long as there's not, that the benefit outweighs the potential harm. I mean, I think that I do chiropractic virtually weekly, body work weekly. So I mean, I think that as you were discussing with your method, getting blood and draining lymph and all of these things, chiropractic, making sure that that your spine and your nervous system's all in alignment. I mean, I think that, of course, all of these things can be helpful. I don't have any specific, story to tell you about, somebody went and did chiropractic and suddenly their Hashimoto's went away. Can I talk about biological dentistry, or, a heavy metal detox, or healing their gut, or getting rid of candida and their antibodies going away? Yes, I can speak to all of those things. I can't,
Which aspect of the biologic dentistry?
well, my dentist is Dr. Stuart Nunley, and if he's not your dentist, he should be yours too. He's in Marble Falls, since you're in Austin. Best biological dentist. I have a podcast with them on my podcast as
Oh,
well.
cool.
But certainly, I personally have not been through any of these. I never had wisdom teeth, so I didn't have any cavitations. I've never had a root canal, and I had like one mercury filling. But I've definitely seen people have root canals and have them removed and have their Hashimoto's or TPO antibodies go down. People with cavitations. These are just dental infections that are creating inflammation. And unless you're going to a biological dentist, they generally are not getting picked up by a regular dentist. I haven't seen as much with the mercury filling removals as I have with people who've had like neurological disorders or autoimmune conditions, and then getting these mercury fillings out.
Have you seen the pictures? I bet you have, or the like the videos or pictures of the mercury fillings and like the gas like filling the brain and all the space around that area, and that's just what you're navigating the world with now.
Yeah. Well, I mean, as he
Pretty
says in
amazing.
his interview, if you drop the mercury on the floor, you just like call in the biohazard team.
Yeah,
But as you're
exactly.
putting it in somebody's mouth or even removing it from somebody's mouth, it's not considered a biohazard. But if it
People
drops on the
we're
floor,
so crazy.
yeah, I'd love to
We're
know how many
crazy.
dentists have, autoimmune and neurological disorders. I mean, that's how Dr. Nunley got into biological dentistry, is that he was diagnosed with ALS, and it
Huh,
was mercury poisoning
huh,
from being a dentist.
huh.
So he went into biological dentistry, and now they have a whole setup of how, they vacuum it, they put a dam in, they, have all these air filters. I mean, all this stuff. So the patient nor them are getting exposed to the mercury as they're removing it.
Wow.
But I was asking, I mean, they still put in mercury fillings.
Hmm. What are other questions as we wrap up here that for a person that if they wanted this podcast to be like somewhat of a quintessential guide to share with someone about thyroid dysregulation and regulation, is there any other questions that maybe we didn't touch on or things that would be important to share with people?
From a functional medicine perspective, I feel like we covered it. We talked about the testing, we talked about iodine, we talked about reference ranges, we talked about healing your gut, we talked about supplemental thyroid hormone, not medication.
Talked about the didgeridoo.
Yeah, I don't know what the didgeridoo is.
Play the didgeridoo, heal the thyroid. That's my recommendation.
Oh, okay. Yep, you
I'm not
talked
an
about that.
expert.
You talked about that. Yeah, and then I think, one of the big things, coming up is traumas and, working through your traumas, however that is, in the mind body connection. So these are all kind of things that have become more of a forefront since I wrote the book. But
I
yeah,
think Gabor Mate, who I've done several podcasts with him, and I've also gotten the opportunity to do body work with him and various different things. I'm very grateful because I've looked up to him for many years. And Bessel van der Kalk would be two common names to go deeper into that conversation of the whole mind body connection and how maybe there is some, well, not maybe, there absolutely is very legitimate science backing up those associations. So it could be something to explore, in my
yeah,
opinion. Yeah,
I agree.
yeah.
And
Um,
pick up
well,
a copy of
cool.
Thyroid Connection if you are dealing with any type of thyroid dysfunction. Because
Yeah,
it will
so that's
help.
so what would be the most, so thyroid connection, obviously people listening to this, I feel like that'd be a very clear direction to go. Is there any other place that you'd point people to go deeper into your work or anything that you think would be relevant for folks?
You can go to my website. There are many articles, free resources, free ebooks. AmyMyersMD.com. I do own a supplement company now. I'm no longer in practice, but I have formulated all of the supplements myself. They're third party tested. So, and many of them are there to support your thyroid, help you heal your gut, reverse autoimmunity, have optimal health. And the company's Instagram is Amy Myers MD, but then everything sort of personal for me is Dr. Amy Myers. So my Instagram is where I am personally. And my podcast, Take Back Your Health.
Which I just was on
Yes.
20, an hour and a half ago, 2 hours ago. Um, Thank you so much. I really genuinely enjoyed this conversation. I don't personally have thyroid issues, but I have close people in my life that do. And so I'm very excited to share this conversation with them. And hopefully people appreciate this and take lots of notes and share it with their friends and family. Thank you so much. I appreciate you.
Awesome.
Thank you all for tuning in.
Thank
That's it. That's
you.
all. I'll see you next week.